Anyway, this is a real funny video. I think the patient was in deep sleep, and I think nursing personnel went to the patient in a PPE, and the patient thought it's a ghost and started screaming at the from the bottom of her heart. So the reason to wear scrubs during surgery is, one, because if you're traveling, you're moving around wearing the clothes, you will tend to get all the bacteria from outside inside the OT complex, which is a sterile, which is a highly, I would say, monitored, environmentally controlled area where you want to have less of bacteria. Second is to also reduce your epithelial shedding. Your whole body is covered. So you are wearing a cap on your head, there's a mask over your face as well as nose, and your whole body is covered with a gown which is sterile, and also your hands are covered with gloves. So this is basically to reduce all kind of contamination during surgery, so that the chances of infection for the patient is reduced to the minimum. So one is wearing sterile gloves so that there is no contact with the sterile tissues of any unsterile thing. We also take good precaution of washing the hands in a way which is recommended to wash your hands before surgery. Second, after that is done, we don a sterile gown, means we wear a sterile gown where the whole body is covered, so that any epithelial shedding, that is, see, our skin sheds off all the dead cells, and which may again fall over the operative area, to prevent that, and also to prevent any contamination from the surgeon's body or from the medical team's body going into the surgical site. And third, as I said, cap and a mask, just to protect that no hair of the medical personnel comes in, or even while breathing the air gets filtered and comes out and doesn't contaminate it. When we are doing a knee replacement surgery, in addition to all this, we usually wear an helmet also. I'm sure you must have seen that in our my videos, where even the whole face is covered by a helmet. There is an eye shield, because when we are operating the knee or the hip, we are coming quite close to the knee of the patient. So there shouldn't be any contamination from the surgeon to the patient, and also to the surgeon, because there are chances of any bone particles of blood getting in and splashing on the surgeon's face. So that also protects the surgeon from those, spillage of the body tissue fluids or even bone. So that is the reason why we wear kind of a different clothing inside the operation theatre complex, and so everybody inside is wearing a different clothing from what they wear outside. The same clothing which is worn outside is not allowed inside the operation theatre. I would like to request all the subscribers to share the video, share the channel, and ask their friends also to subscribe to my channel. Thank you, and we'll try to keep this content as far as possible in simple words in English, so that सबको समझ में आए एंड इन्फॉर्मेटिव. अगर आपके पास कुछ भी ऑर्थोपेडिक रिलेटेड क्वेश्चंस हो जो मैं आंसर कर सकूँ, आप प्लीज़ कमेंट्स में लिख दीजिए, ताकि नेक्स्ट जो भी मैं वीडियोस बनाऊँ उसमें मैं वो कंटेंट के बारे में इंफॉर्मेशन दूँ.